Good afternoon, everyone, and thank you for joining us today for this webinar on applying infection control basics in congregate care settings. I'll be your facilitator today. My name is Abby Velasco, and I am with Commonwealth Medicine at UMass Medical School. So we're still seeing a high numbers and transmissions in congregate care settings, and because of this, EOHHS and their state agencies, including DCF, DDS, DMH, DPH, DYS, MRC, and MCB, along with Commonwealth Medicine, have collaborated to offer this training. Our goal is to educate and reinforce known best practices and support staff in their work in caring for some of the most vulnerable residents of the Commonwealth, and also in keeping themselves, their colleagues, and their families healthy and safe. We want to start off by thanking you for taking the time to complete the registration and for submitting your questions. We embedded some data and we use the questions to help focus the content of this webinar. We do want to let you know that we might not have the opportunity to answer the questions today, but we are going to be offering office hours, which will be question and answer sessions at a later date. So we'd like to encourage you to have a pen and paper handy or the copy of the presentation and make some notes of the actions that you think you or your organization can take to prevent or reduce COVID-19 transmissions. So let's go ahead and get started. I want to introduce you today to Maureen Spencer. Maureen is our presenter. Maureen is an infection preventionist for over 40 years. She's a board certified in infection control. Maureen is a registered nurse and an independent infection preventionist consultant who has been awarded a number of awards for her work in infection control and prevention. Maureen has worked as the infection control director at New England Baptist Hospital, and she was the director of the infection control unit at Mass General Hospital. Currently, Maureen works with Commonwealth Medicine, providing infection control consultation to programs and facilities across the Commonwealth. So I'll turn it over to Maureen.
Thank you, Abby, and I want to thank EOHHS and the team at Commonwealth Medicine who collaborated in putting this training together. And so the learning objectives of the webinar: review the basics of infection control in order to train others, identify scenarios when hand washing should be utilized, identify scenarios when applying alcohol-based hand sanitizer is appropriate, identify scenarios when personal protective equipment should be used, demonstrate the correct procedure for putting on, or what we call donning, and removing personal protective equipment, or what we call doffing, and identify what should be cleaned, disinfected, and how frequently. You also will be able to list the contact times for commonly used disinfectants in congregate care programs. So to prepare congregate care managers, program staff, and state agency congregate care staff, we have put this webinar together to help you train and monitor staff and residents in the congregate care programs on infection control practices to prevent and decrease exposure to illness. So based on the registration, this is a description of who is on the call. State agency affiliations: the Department of Corrections, Domestic Violence Centers, Department of Secondary Ed, Department of Early Education and Care, Executive Office of Health and Human Resources, and many others. We want to thank you all for getting onto the webinar. Our goal is to have a train the trainer approach to infection prevention education. For those of you who are attending, the goal is to have you go back with this information materials from the webinar and other material we'll make available and share this with your staff and do the train the trainer program. We will have visuals to print and post. There'll be other videos on basic infection control. And in the facilitator's guide, there'll be more information on how you can improve your infection control program. So data is reported weekly at this website on mass.gov. And this shows you the current state of the number of COVID cases in congregate care settings from the EOHHS dashboard, which is updated weekly. This is the reason we are offering the training at this point in time. This training is a complement to the risk assessment that many programs have completed and the consultation work that EOHS has made available to state-operated and provider-run congregate care settings. The best way to prevent infection with SARS-CoV-2 is with basic information control measures. Wearing a mask. When we wear a mask, you will see when we get into transmission how important it is to prevent, if you are either asymptomatically infected or infected, particles coming out of your mouth to another person or the environment, and how you can wear a mask to prevent yourself from inhaling those particles. Frequent hand hygiene, since surfaces will be contaminated around patients who have asymptomatic or symptomatic COVID infections. Social distancing, making sure that you keep yourselves a good distance, at least 6 feet from other people. Respiratory etiquette includes covering your coughs and your sneezes, and you always see people coughing or sneezing into their elbow or under a shirt. That will confine and contain any of those droplets. We want you to clean and disinfect your surfaces often in your environment and monitor your health. It's really important that if you start to feel ill, that you report yourself to your PCP and get evaluated. Now, some vaccines are available. The Pfizer and the Moderna is available, but we're in the process of obtaining what's called Emergency Use Authorization, or EUA. You may see that in the literature, and that's for the CDC to give authorization, get additional vaccines out into the market. So COVID-19 treatment has dramatically improved with new drug combinations and these enhanced care strategies due to the experience of caring for COVID-19 patients. And as a result, the mortality has been reduced significantly since the early days of the pandemic, when less was known about the disease. Have you had training in infection control in the last year? So here is the results of that. 57% said yes, and 43% they haven't had that training yet. So we're hoping that you'll use this webinar to train others. It's important in infection control, the terms confine and contain. We even use that with fire safety. You know, we want to make sure that we prevent COVID-19, the virus that causes it, called SARS-CoV-2, to get around and move around the environment. So let's first look at how transmission occurs. So we have direct contact, where an individual is exposed to the infectious viruses by direct physical contact. We have indirect contact. An individual is exposed to infectious viruses by physical contact with contaminated objects. We have droplet transmission. The infected individual releases infectious agents via droplets to another person in close proximity, which again is why we have that social distancing. What happens, these droplet nuclei get suspended in the air for hours, and they can then be inhaled by other individuals who are further away. And then there's airborne transmission that typically occurs during an aerosol generating procedure, where infectious virus-laden aerosols get released into the environment with the potential to cause infection if they get inhaled by a person close by. So infectious particles are produced by evaporation of liquid droplets to a small droplet nuclei. The droplets tend to be very, very large when we first cough out and sneeze, and by gravity, they pull them down to the earth. It's pulled down, and it usually just desiccates, meaning it dries up. But in this situation, when it evaporates, the non-evaporative contents concentrates, and this is where we get what's called often in the medical field a bioaerosol, or a droplet nucleus. And these can remain suspended in the air for much longer period of times than the liquid droplets. And this explains exactly why mask wearing is critical. Now, SARS-CoV-2 can spread quickly from one person to another. As you can see, one person can spread it to 2, they can spread it to 4, they can spread it to 16, and so on. And this is why social distancing and the basic infection prevention measures are so important to follow diligently to prevent spread from person to person. And one thing we know in outbreak investigations and pandemics is that the diligent is the difficult part. It takes discipline. It's very hard for us a year into this to continue to wash our hands and to clean the environment, but most importantly, to wear the mask. But this explains why those measures are so important at the moment. It shows us how a virus with a reproduction number of 2 spreads in a non-immune population very quickly. The concept is to treat all residents as if they're infectious. And that's what we call standard precautions. And this actually came in the late 1980s after the AIDS epidemic. And it was implemented by the FDA. And we all implemented at that point what was called universal precautions. And then it was changed to called standard precautions. That we treat everybody as if they could be potentially infectious. And that involves hand hygiene, which includes both hand washing with soap and water, as well as alcohol-based sanitizers. Under respiratory etiquette, it involves covering coughs and sneezes to prevent the spread of droplets and these aerosol particles. It also involves the use of personal protective equipment so that your clothing, your face, your eyes will not get contaminated, as well as your hands. Proper waste disposal. Once that material is contaminated, we have to have proper waste disposal of it and make sure it doesn't contaminate other surfaces. And then the disinfection of the environment with EPA registered disinfectants such as bleach wipes or Lysol wipes will kill this virus. We also have categories that are called transmission-based precautions. And this includes standard precautions, and plus there are additional things that we would do. So under contact precautions for direct or indirect transmission, gowns and gloves are worn for all contact with all the residents. A private room is preferable. In some situations, the residents may be placed together in a room or area referred to as a cohort, where we actually group people together who are infected or potentially infected. Droplet precautions is for residents with infections transmitted by droplet nuclei, such as influenza, mumps, pertussis, and mild cases of COVID-19. Preferably, a private room is required to isolate the resident from others, and a surgical mask is worn when entering the room. Airborne precautions for residents with infections that we know are transmitted by the airborne route. And these are small aerosol particles that suspend in the air, and they can move great distances. Infectious diseases that require airborne precautions include tuberculosis, chickenpox, measles, and COVID-19 pneumonia. In the hospital setting, we use negative pressure isolation rooms to confine and contain the infectious aerosols, since many of these patients may be in the ICU undergoing aerosol generating procedures. Here's another question we asked on signs, equipment, and training. So do you have signs or other visual reminders about hand washing posted in your area? 96% said yes. Do you have access to basic personal protective equipment? We saw that many people said yes, 99%, so that's fantastic. And have you had any training on the use of the personal protection equipment? And this is 89%, so that's good, because those 11% that said no, we have some really good videos in this webinar that you can use for that kind of training. So what can your programs do to confine and contain and prevent spread? One is practice social distancing, conduct COVID-19 screens for staff, visitors, and contractors prior to entering the program sites. You even see that now in a simple way that you go to a restaurant, they'll ask you for your name and your phone number in case there is an exposure. So we should be making sure that we know who's coming in and we screen them for any symptoms before they come in. Stagger your staff breaks to promote the social distancing. Monitor and document hand washing and putting on and off PPE. And clean and disinfect your environment frequently. Hand hygiene and respiratory etiquette. The World Health Organization has developed 5 steps to hand hygiene. So they recommend that you do it before you touch a resident. You don't want to bring organisms from a previous resident or in a contaminated environmental surface to a resident. So it's important to come with clean, sanitized hands. The second is before you do any kind of clean or aseptic sterile procedures. You would sanitize or wash your hands after contact with blood or body fluids, such as urine, feces, or sputum. You would then sanitize or wash your hands after touching a resident so that you remove those contaminants before you go and touch another person, and after touching contaminated surfaces and objects. And DPH recommends that you use hand sanitizers throughout the day often. Just constantly be sanitizing your hands. It's one of the best protections that we have. So here are pre-webinar questions on barriers to hand washing. The number one was compliance and consistency. You know, people adhering to the protocols. Forgetting is very common. We get so busy, especially in healthcare, that we just forget, you know, before we touch somebody or after we've touched them, and really taking it seriously is another issue. It's so simple. One of the best measures is just sanitizing and washing your hands. Oversight is ensuring it is done, reminding students and residents and monitoring. There are hand hygiene audits that are available on the CDC website, just simple ways that you can do audits to monitor and make sure people are doing hand hygiene when they should be. Another issue you all struggle with is the ability of the residents to participate in hand hygiene. Maybe there are physical disabilities, their behavioral health status, or cognitive or developmental disabilities. It also takes time. Washing your hands, you'll see, requires 20 seconds with soap and water. And so that can be a challenge, not long enough, or getting into kind of a bad habit of one of these really quick little washes. So we'll go over the hand washing procedures that are correct. Awareness. Some would just have lack of knowledge of knowing how important something so simple can be, and helping people understand that importance. The availability of sinks. You know, often in your settings, there may be limited sinks or proximity to sinks, or no sinks in the bedrooms. And access to supplies, in some situations, shortages was a problem with assuring good hand hygiene. So we're going to watch this very short video that you can share and make sure your staff know how to do hand hygiene. So you can get the YouTube video link on the site and show this to your staff. It's a very quick video. Now, hand washing for hand hygiene involves the use of soap and water, covering all the surfaces of your hands, wash between the fingers, under the nails, and the tops of the hands and the thumbs. In observational studies have been done, they show that a lot of people forget their thumbs or under the nails. Washing your hands for 20 seconds, they have shown that if you sing happy birthday twice, or you say the alphabet very slowly, you can time yourself and get up to 20 seconds. You need enough time to cover all the surfaces and get rid of the organisms that you picked up on your hands. Make sure you use paper towels to shut off the faucet handles. You contaminated them as you came to wash your hands, so you don't want to recontaminate them after you wash. Make sure you wash your hands before and after going to the bathroom, and after coughing or sneezing or blowing your nose. The good news about this SARS-CoV-2 virus is that soap can actually destroy it. This is called an envelope virus, where it has this lipid, fatty membrane around it. And what's really, really good about the soap molecules, they can wedge themselves into it, the fatty membrane, and pry it apart. So again, the best way to avoid getting infected is, first, what's not on here, wear the mask so you don't pick up the droplets and bioaerosols and inhale them. Wash your hands, avoid touching your face. Keep your distance from sick people, and regularly clean contaminated surfaces. These videos will let you, these are about 2 minutes. They're from the CDC, and you can show these to your staff. So let's now talk about the airborne transmission through particles. So the aerosol particles in the first photo shows somebody who's either asymptomatic or they become symptomatic, and these aerosol particles move out of their nose and their mouth into the environment through coughing, sneezing, and especially loud talking, they have found in research. This is what we want to confine and contain. When you have a mask on, it's going to keep those particles behind the mask. And when the other person has the mask on, it will prevent them from inhaling those particles as you're in the vicinity of them. Number B picture shows an aerosol generating procedure. We intubate patients in healthcare settings. We suction patients. We might give a nebulizer treatment. So that's how, through these procedures, we may get aerosols that start to move around the environment and could actually come, and you could inhale them if you're not properly protected. The other is on CPAP. This is a CPAP machine where you can actually see the particles coming out, and they're very small particles that come out of these exhalation ports. So that would be considered an aerosol generating procedure. So during AGPs, which is what we refer to them, identify and respond with appropriate PPE protection to reduce your exposure risk. Whenever involved in one of these procedures, be sure to utilize the following controls. You want to don an isolation gown to prevent your clothing from getting contaminated, so you go home with that contamination. Wear a respirator, and DPH does recommend an N95 when you're doing this type of procedure. Or a mask. If you don't have an N95, you can use a surgical mask. Wear a face shield or safety goggles so it doesn't get into your eyes. You could actually get the virus into the membranes of your eyes and get infected. Make sure you wear exam gloves and wash your hands after removing those gloves. Nebulizer use at home is necessary for residents with asthma. And if they have symptoms or a diagnosis of COVID-19, it's recommended you perform the nebulization in a location that minimizes and avoids exposure to other members of the household, and preferably a location where air is not recirculated into the residence. I also point out very often in these settings, be careful you don't have a fan that's blowing in that area, during these kinds of procedures. And also another engineering control is just simply open the window for a while to dilute the air in the room. But you can also consider physical barriers. You see those a lot now in restaurants and stores where they have a plastic screen that is a physical barrier. And also maybe a portable solution is a portable HEPA filtration units to augment air quality in areas where you have permanent air handling systems that are not a feasible option. Another note is that medical teams may switch to an MDI inhaler instead of a nebulizer during this period of time. So using a CPAP machine can spread the COVID-19 virus even further than coughs and sneezes do, because the CPAP mask makes even smaller drops. And these tiny drops can stay in the air for hours and can travel to the whole room. So if someone has COVID-19 and uses a CPAP machine, they should isolate in a separate room. Another option is to actually have short-term stopping of the CPAP, which is less risky than continuing CPAP and potentially spreading the virus. Research has not shown an increase in medical complications from temporarily stopping CPAP usage. Make sure you wash your hands thoroughly with soap and water before and after handling the CPAP device, the mask, the tubing, and the filters. Personal protective equipment and waste disposal. Personal protective equipment would be used for precautions such as standard, transmission-based, and the aerosol generating procedures. PPE requires assuring the procedures for donning and doffing are done correctly. And also how to apply masks and respirators correctly, the do's and don'ts, and fit testing. There is a link to guidance on putting on N95 masks in the facilitator guide, which comes from the cdc.gov NIOSH documents to recommend the proper way to put them on and take them off. There are several types of face coverings, masks, and respirators. Homemade cloth mask coverings are good for low-risk jobs, but we really don't recommend them in your settings, the congregate care settings. They would be good for outside, but not in these settings. What is recommended, a disposable surgical style mask, because there are medium risk jobs that you're taking, keeping droplets from escaping into the air and from you inhaling them. And then for high and extremely high risk jobs, it is recommended that those who work with the COVID-19 patients or suspected COVIDs use a NIOSH approved N95 respirator. So many people get very confused about the difference between an N95 mask and a KN95 mask. Both of them are made from multiple layers of synthetic material, typically a polypropylene plastic polymer. Both masks will filter out and capture 95% of these tiny 0.3 micron particles. So again, once those droplets, the larger droplets that tend to be over 1 micron, which either settle onto surfaces of the floor or your nose is able to filter them out early on in the anterior areas, these smaller particles can bypass right through the nasopharynx down into the deeper parts of the lungs. So that's why you want to use a good mask that's going to prevent you from inhaling those particles. That's the N95s. Regardless of where these masks are manufactured, the KN95s are typically regulated by the Chinese government, where the N95s are regulated by the National Institute for Occupational Safety and Health, called NIOSH, in the United States. That is the only difference. They will perform almost identical, the KN95s to the N95s, and they have virtually the same filtration rate and are therefore equally safe if they're properly certified. KN95s might have ear loops. Most N95s only attach via head straps. Now, the KN95s might be more readily available for purchase as the demand for the N95s continues to rise. And DPH recommends the use of the N95s and also recommends you do not use one that has a valve on it, because that valve can allow aerosols to come out. So check out this disclaimer about KN95 masks on this website on mass.gov related to the KN95 standards. So PPE, or personal protective equipment, there are procedures for donning or putting them on, and for doffing or taking them off. So perform hand hygiene first. You want to make sure you don't have contaminated hands that you now start touching your PPE before you're going to put it on. Once you've done your sanitizer is fine. You sanitize your hands, you put on the gown. Now you put on your mask, either the surgical or the respirator. You put on your eye protection, it could be safety glasses or the shield. You perform hand hygiene now, and a lot of people ask us why. At this point, you might have touched your hair putting on the mask or your face, and now you're going to put on gloves. And organisms can multiply every 20 minutes, and so it's important that you have the cleanest hands before you put gloves on. Often you have gloves, you start sweating, you're going to have them on for a long period of time, and you can actually start to grow organisms under the gloves. So sanitize, sanitize, sanitize. We can't say enough about how much to just keep sanitizing, but this is the correct donning procedure. Now, doffing is a little tricky. And sometimes it's great to have a person there to help you get the gown off, untie it in the back or whatever. But first you remove the gloves. They're contaminated. Your hand's now contaminated. Remove the gown. Now you perform hand hygiene, because your hands are definitely contaminated as you bring that gown down. And there's a correct way to envelope and seal that gown, taking it off, that you'll see in some upcoming videos that you can share with your staff. Now you perform the hand hygiene before you go up and start touching your face, your eye protection, taking that off. Now you're going to touch the contaminated surgical mask or respirator. You're going to take that off and again perform hand hygiene. So really good posters are available on the CDC website that you can post in those settings where you are doing a lot of PPE donning and doffing. But here are 2 videos from CDC that you can share with your staff. They're about 2 minutes in length, and these are really good for your training. Environmental cleaning and disinfection. We asked the question, what do you use to disinfect surfaces? And we were pleased to see that about 99% responded that they're using a disinfectant cleaner. And most of them are bleach, some are Lysol, and some are alcohol wipes or germicidal wipes. All of these will kill SARS-CoV virus. The way that you decontaminate surfaces is to first clean them. So we'll get into that in a moment. If it's got any kind of body fluids or secretions on it, you have to clean that up first before you then use a disinfectant. So you want to decontaminate it with the appropriate disinfectants. And there is a list on this EPA.gov, the pesticide registration list, that you can look that up and see if your product is on that list. And that has an approved label claim effective against SARS-CoV-2. Normal routine cleaning with soap and water should be done first if there's germs and dirt from the surfaces that you want to remove that. Sometimes it's just basic dirt that we'll see. Other times it is secretions or excretions. So that's going to lower the risk of spreading COVID-19 infection. Now the disinfectant goes on the surface to kill any germs that might be there. So it's after cleaning. Now, some disinfectants have the action of both maybe a detergent surfactant in it as well as a disinfectant. So check your labels to see if this says it both cleans and it disinfects. So that's why you want to make sure that you look at the labels, know your disinfectants, and especially know the contact times. That means that after you've sprayed or poured it onto a surface, how long does that have to sit in order for it to work? And that's what we mean by a contact time for complete disinfection. Make sure you store and use disinfectants in a responsible and appropriate manner according to the label. Do not mix bleach or other cleaning and disinfection products together. This can cause very harmful fumes that can be dangerous to your health if you breathe them in. Especially keep disinfectants out of the reach of children or others. They may have any kind of disabilities that may get access to them. Make sure you lock them up. And always wear gloves for the chemicals you're using. And some of them, if you look at the labels, may actually require you to use face covering as well to protect your eyes. So here's a table of just some of the common disinfectants, their brands, the companies they come from. But we just want to illustrate here the contact time. You can be as low as 1 second or half a second, all the way up to 10 seconds. So that's why it's really important to look at the back of the labels and make sure not only do you know the contact times, but take a black marker and actually circle it. So your staff will know, or put a label, a sticker on it and put 2 minutes or 10 minutes. And recommendation is that you purchase ready to use disinfectants. We do this even in hospital settings. We don't really want people mixing and diluting any kind of disinfectants. And there's so many now that are available, as you know, that you can just buy these products and they're ready to go. So there are 6 steps to using disinfectants that are recommended. The first is to check that it's EPA approved. You want to look for the EPA registration number on the product label and then go to the website, the EPA.gov website with the list, and see if your product is on that list. You can actually just put that number in and look it up. Read the directions and follow the product's directions. We call these IFUs, information for use. You'll hear that term a lot of times in infection control. Check the user site and surface types. There are some disinfectants that might harm. Bleach can be a difficult product to use on some surfaces. So make sure that you look at the product surface types and precautionary statements. 3 is to pre-clean the surface. Make sure to wash it with soap and water is fine. If the directions mention pre-cleaning, or if the surface is visibly dirty, and get that cleaned first before the disinfectant's used. Follow the contact times. You can find that in the directions, and it should remain wet that whole time to ensure the product is effective. Wear gloves and wash your hands after you've taken your gloves off. If you are using the reusable gloves, dedicate a pair that's specifically for disinfecting COVID-19 rooms. And as I said, wash your hands after removing the gloves and lock it up and keep the lids tightly closed and store out of the reach of children and others. Now make sure that you clean different devices that you might touch. We have a whole bunch of mobile devices and phones and other things these days. So use a disinfecting wipe that's compatible with your device. For the most part, all of these can handle those germicidal wipes that most of you probably have. Remember, your phone touches your face. And due to today's risk factors, you want to make sure you're cleaning these often. You wash your hands before and after using a phone, and cell phones can be disinfected with these disinfectant wipes. So now we're going to look at some of the summary and the resources for the presentation. But before we do that, it's very often that this gets left out of these types of presentations. You have a robust, healthy immune system. You can fight infections. That is why maybe in a household, one person got it and the other person didn't get it. It all comes down to the immune system. We see this all the time. Tuberculosis in one family member that was in the house and nobody else gets it. Eat healthy, really good fruits and vegetables. And a lot of times people tend to kind of move over to things that help their serotonin level, which is a happy hormone. And what it is, sugar. Sugar will actually increase temporarily. So make sure that you reduce alcohol, anything that ferments, has a fermentation to it that will make you acidic. Studies have shown that things like alcohol and sugar can depress the immune system. And also take care of yourself from a stress reduction point of view. Get out and walk, get some fresh air. Maybe some of you stretch or do yoga, meditation, prayer, whatever, to get your mind settled back down before you go back in and take on another day of this high stress environment we're all under right now. So we really highly recommend that. And in summary, make sure that you use appropriate PPE for your contact with infected residents, as well as those you suspect to be positive. Get really disciplined about it and consistent. Observe proper donning and doffing and record those competencies in your staff. This is a train the trainer program, so we're hoping that you will become the infection prevention coordinator for your facility, and you really get into this and take it really serious with them and get them to appreciate it and understand how to really properly put on and take off the PPE. We see a lot of infractions with that. Just notice in the community how people touch their masks all the time, or where they wear their masks under their nose. Practice social distancing. Use your face coverings and frequently wash your hands throughout the facility, center, or group home. Most all the hospitals today, everybody's wearing a mask to go into the hospital and work in the hospital. So, this is something you can do consistently to make sure you're not going to inhale it from someone else. Train your staff in proper hand hygiene. Make sure they understand the hand washing procedure and they understand the alcohol-based hand sanitizer procedure by using those videos we provided. And then follow the guidelines that are clear on the CDC and Mass Department of Public Health websites. Here are some of the links that you can use for CDC and then the DPH. We also have these links here for CDC, the EPA, and then the hand hygiene guidelines, and also the duration of isolation for COVID. Also, there's really good guidelines on the CDC website about congregate care programs, caring for somebody in the home if you get a family member who has it. So this is just a great resource that you can just type in what you're searching for and find it on the CDC COVID site to be able to prevent transmission. So I want to thank you all for listening to the webinar, and now I'm going to turn it over to Abby. Thank you.
Thank you, Maureen, for sharing your presentation with us. We just like to remind everyone to share this information with your staff. We will be recording this. We did record this version, and we'll share it with you as well so that you can share that with the rest of your staff. You want to utilize the tools in the facilitator guide in your programs. And lastly, we'd like to remind everyone that we will be offering infection control office hours for questions. It looks like we have a couple of minutes, so I'm going to go ahead and go through some of the questions that you asked in the chat box. Maureen, one of the questions was, how long after using a CPAP machine do aerosol particles remain airborne?
That's a good question, and we haven't done any research on that. These machines, as you know, if anybody's had a CPAP or been around one, it pushes out the air. And if you're infected or even asymptomatic and don't know you have it, those little bioaerosols can push out because they're smaller, go into the air. And we do know from the research studies that have been done on air contamination, they move around for hours. Usually it's in the category about 3 hours. One thing when you look at studies to note is some of the studies have looked at the mRNA, the virus itself, but that doesn't mean it was the live form of the virus. So we had to identify that pretty quick when we were hearing, long periods of times of virus being around or being on surfaces. There's a lot of work that's come out now showing that, it's a couple of hours, maybe some situations 3 or even up to 5 hours. So again, that makes sense why you want to have somebody who has to use a CPAP. I mean, there are some patients who get very low oxygen if they don't have it on, so you'd want them in a private room. And try to use an engineering control, maybe one of those shields, or opening the window a little bit to dilute the air.
Thank you. Do you have recommendations about wearing double mask? Recent articles suggest the benefit of wearing a disposable surgical mask over an N95 to protect the integrity of the N95. It looks like they've also seen lots of public figures wearing a cloth mask over an N95 or KN95.
Yeah, I think we tend to see that there have been a couple of really good articles that have done research on masks, and you probably know the one that doesn't have the best protection that you see often out in the public are the bandanas, or something like that, where people just pull up a shirt type of a thing over their nose, like a jersey and so forth. The best one, if you're in the public, are the surgical type masks, but we had such a shortage of those. That's why they recommended the public to use the cloth. As a result of that, many people are using 2 of them. I mean, I have a son who works at Lowe's and he definitely wears 2 of them. They haven't got them wearing N95s yet because they have such a shortage of N95s, but that just gives you that double layer of protection. The only issue is that it's very hard to breathe when you have these on, when you have double layers of protection.
Mhm.
I think when we talked about aerosol generating procedures, and if you didn't have any N95s or KN95s available, then that situation would make sense to wear a second mask and give yourself that extra layer of protection. That's a good question.
Thank you. When an individual we support is using a CPAP and is not COVID positive, is isolation gown still required?
Well, if they're not a suspected case, they haven't had exposures. I mean, it's kind of hard to tell if you think about it. That's why this has transmitted so quickly. Because again, standard precautions we use for everybody, which is wearing the mask, social distancing, and washing your hands. That's the basis to it. But in that kind of a setting, it might make sense if you've got some COVID cases in your facility or your home, and you've got somebody on a CPAP machine, even plastic aprons, I see those used a lot of times rather than use the full cloth, just so the front of the clothing doesn't get contaminated. Also, when you go home, it's really important that you just spray or wash down your shoes. And we have studies that are showing how much contamination gets on the floor. And also, if you think about those droplets, they're going to move down to the floor. And also, your clothing should be taken off and you should change, or get that washed right away before you start hugging kids and, significant others in your home. So there's no recommendation about putting everybody who's on CPAP on contact precautions, only if we think that they have been exposed and they're a likely case or they're infected.
Thank you, Maureen. What have congregate care settings done to combat the effects of frequent hand washing, cracked and dry hands, etc.?
We deal with the same thing in the acute care setting. People get cracked hands from the alcohol, and so a lot of the hospitals, ones I've worked in, we always had next to the hand washing sinks, we had lotion. They had dispensers of lotion that automatically, just like a dispenser of soap, dispense the soap. The problem with lotion, if you start sharing lotion that has one of those little tips on it, a pump, and you touch it and the next person touches it and others touches, research in the past has shown they can get contaminated and cause cross contamination. So that's why if you're going to use them, either little individual bottles of lotion, or you recommend they bring in their own lotion and carry it with them. Or if you're in a facility that wants to put them on the wall, then you have the ones that are similar to, soap, that it's an individual container that dispenses just a small amount of the lotion. A lot of these companies that sell these kinds of products, whether it's Ecolab or Purell and so forth, have that capability to have those kind of mounted, but it costs a little bit more money. So I always recommend in these settings, you carry your own. They have some now that are just on chains. I've seen healthcare workers wearing around their neck a bottle of sanitizer and lotion. So they have it with them all the time. I do. I actually wear one that's around my neck, one that I got so that I have it on me all the time, especially if I go out in the public.
Perfect. What's the best practice for cleaning high touch items like keyboards, computers, mice, etc., that have sensitive electronic components?
Yeah, that's where the manufacturer's IFUs come in. You might have to jump online and look if it's a Dell computer, or, Lenovo, and look it up. The screens are really tricky. You have to be very careful with what you put on the screens. Sometimes they recommend just even water wiping the screens down. There are also some products that are long-acting antimicrobial solutions that could be sprayed, and they give you, action up for a couple of hours. Those are even available on the market. So, but I would definitely get in touch with the facility, whatever company you're using, HP, Dell, whatever, and find out what they recommend for both the keyboards. I know we've had in the past problems where they started to wipe down all the keyboards and some of them got stuck. They got kind of gooey because people were using sanitizer, and many of the sanitizers have either aloe or some kind of an emollient in it to help your hands from getting cracked. So that's not a proper use of sanitizer as a disinfectant. So therefore, germicidal wipes, for the most part, alcohol wipes or these, Clorox wipes, usually can be used, but you've got to be careful about screens. That's the one thing you've got to check. I've seen many, a monitor, a Dynamap, the vital sign machines destroyed by the disinfectant wipes because we didn't check with the manufacturer.
Okay.
A great question. Yeah.
Is there temperature considerations that can lower the transmission of the virus? Like, for example, keeping a house cold or hot?
Well, what we do know about even influenza is that when your mucous membranes are dry, so you have the anterior nares is this first part of your nose where the outside skin envelopes into the inside. And then where they, if you've ever had a COVID test done, they stick the NP swab, nasopharyngeal swab, way deep up to get into the nasopharynx. So the first line of defense we have in our nose is hair that filters dirt and large droplets out. And then it moves up, the tiny bioaerosols get further up. If they're dry, absolutely increases your risk for infection because your immune system cannot function. It's so dry, the virus has no problem just getting into the cells. And what they do is they embed themselves with the crown there. That's why they call it corona. And they kind of puncture the cell, get into it, and start making a factory and making millions of copies of itself that then start to transmit throughout the rest of the body. So humidity. It is so important to keep your humidity over 40% in your household. That being said, if you do go and use humidifiers, they have to be clean, just like the CPAPs. Anytime you have standing water, you can have organisms, the gram negatives especially, can start to grow in them. So you just have to make sure that you follow their recommendations for disinfection if you get a humidifier in home settings. But that is by far the best way, is to have your humidity at a higher level.
Perfect. How often should common areas be sanitized?
Most places are doing at least now because of COVID on an hourly basis, just walking around. I was in a nursing home recently, and once a day they go down and do all the handrails with this long acting antimicrobial, and they spray them with the jet gun. And so they do it every single day. So you have to look around. I key thing as a trainer and as the infection control coordinator for your site, that you start looking through our lens, our eyes as an observer, and start looking, what do people touch a lot? Think about common areas where, people are sharing puzzles, or people are sharing, games, or people are touching chairs and, as I said, railings and doorknobs. And those are the areas that consistently, if they could just get disinfected on a routine basis. Now, you probably say, how can we ever do it on an hourly basis? Sometimes we can get other people to help out. A lot of places are actually having their residents pitch in, and maybe do a little cleaning in their own room or at their own sink, to high touch surfaces and so forth. So again, just watch and you'll start to see those high touch surfaces, and then just these sandy clots are just easy to wipe those down on a frequent basis. Nobody has come up with, like CDC or EPA hasn't said, on an hourly basis or every 4 hours. Often you'll hear them say once a day. But being an infection prevention nurse, I just used to say to the staff, clean your workstations on wheels, those computers on wheels, often, constantly, throughout the day, keep wiping them down, because you're going in and out of rooms and you might contaminate the keyboards, and, just do it consistently. But you'll have to decide for your site what that means, how much COVID you have and how many patients maybe put blood or body fluids in the environment. You've got very unique settings that you're all working in. So you have to kind of personalize that.
What is the contagious longevity of the virus?
So what happens with the virus is when you get exposed to it, it takes about 4 to 5 days for that virus, once it gets up into the nasopharynx and starts its manufacturing of little viral babies, and increasing its load, and it starts spreading throughout your body. That 4 to 5 days is when you're the most infectious, actually. So if some people get exposed to it and the next day they have it to high temperature, or they're feeling like they have flu-like symptoms and they're sick and they're having a hard time breathing. After about 5 to 8 days, we always say probably would be safe at 10 days, it becomes really not that infectious. So that's why CDC has the link we gave you when you could take people off of precautions. So now it's down in their body, it's done its damage. And, the thing about SARS-CoV-2 virus, it's more like of a blood type of infection, the way that it affects this particular protein, ACE2 protein, that lines the endothelium around your vessels in your body. So that's why you hear people get these, ground glass type pneumonia, they get blood clots. And this is a very unique virus. It's different from the influenza virus. So That's about a good 8 to 10 days that we find that people are no longer transmitting it out in the environment. The problem is if it's in the first 4 to 5 days, often you don't even know if you're asymptomatic that you have it and you're transmitting it to others. And so it goes back to what are we going to do? Masks, social distancing, and hand hygiene. That's about the best we can do, as well as the vaccines. And I did want to mention something about vaccines, by the way. I should have done that on that slide when we mentioned vaccines. This vaccine, the Pfizer Moderna vaccine, ought to prevent you from getting a serious response to the SARS-CoV virus if it gets in your body, right? What you see, these people that end up in the intensive care units with a very severe reaction. It's almost like getting an email into your DNA and the messenger RNA, it downloads a message and then it disappears, right? And that message is able to help the immune system fight it so that you're not going to get this severe reaction like some people get. It does not prevent you from getting another case, a case of COVID-19. That's where there's been confusion because we're so used to getting a vaccine and saying, oh, good, we're not going to get it. This is going to help us with measles, mumps, rubella. We're not going to chickenpox virus. We won't be, we won't pick it up. Well, that's not what this virus, what it's about. So even if you get a vaccine, you still have to use the control measures. You still need to wear a mask, wash your hands, and social distance. It's a shame that I've heard so many people say, well, I got the vaccine. I don't have to wear my mask anymore. I don't have to worry about it. And I'm like, no, you still could get COVID. It just helps your body from having a very severe reaction if you get it. So on the website, CDC's got a great vaccine site, and they actually have a whole section that talks about congregate care sites and about vaccines. So I would highly recommend, as the trainer, as the infection control coordinator, you get on these websites and get yourself a little bit more educated about questions, because a lot of questions come up about the vaccine. Yeah.
Thank you for that. How many strands are there now?
Variants, we have 4. All right, so we know that we have the SARS-CoV Wuhan strain, which it's interesting that typically viruses often get named over an area like the bird flu, Asian flu, and so forth. This got called COVID-19 for representing, a coronavirus infection that happened in 2019 is its name, but that's the first strain. And then the second strain, the B117, happened in the UK. And right now, you got to remember, we're still looking at all the literature and trying to figure out, is this more infectious? It may be more infectious, but does it cause more morbidity and mortality as a virus? We're just starting to get papers coming out on that. And then there's a strain from Brazil. And then there's one more strain I thought I saw yesterday in an article about another strain. The problem with viruses is they can mutate, and they are brilliant. That's how I got into this field of microbiology. As a kid, when I was 15, I worked in a lab. I was just so amazed at what they can do and how they can attack our bodies and replicate, and the artillery they use and so forth. This virus can mutate. So they are looking right now, the Moderna and Pfizer vaccine will cover the strain from the UK, the BB17, but we're not sure about the other strains yet. You've got to remember, we're in the middle of a pandemic, and we're all, as scientists, learning as much as we can quickly about this virus. So hopefully it will stop mutating, or they're going to start, I just saw that, I think it was Moderna or Pfizer is going to start looking at maybe developing another vaccine that will hit some of the variant strains. So just keep updated. That's all you can do. And the best place is the CDC website.
Thank you. So we have about 3 minutes left. I just want to see if we can go over a few more questions. How long do the droplets stay in the air if someone sneezes in the line in the grocery store, and can spread it to you if you're standing in line?
Well, if somebody's infected and they don't have their mask on, which I see a lot still, people that just don't believe in the whole mask theory, and you're 6 feet away from them, which I'll, look on the floor, these stores are putting the 6-foot mark. The other thing you have to appreciate about, like, say, a big supermarket, Walmart, or your big Stop and Shops, or places that are big warehouses. They have good, more clearing ventilation. Okay, then a small house where you've got people congregated in a living room or a room where there's more sharing of the airspace. So that's probably why we haven't seen a lot of major outbreaks coming from settings like that, and why they say it's safe for us to be able to go in. But if somebody's got that COVID and they don't have a mask on, it's going to go for about 3 hours. It can settle in the air. So again, if you have your mask on and you wash your hands, that's the best that you can do in order to protect it.
Do goggles keep you from getting COVID droplets in your eyes?
Yes, definitely. So that's in healthcare, we will use for bloodborne pathogen standards. I mean, if somebody has an infection with HIV, even hepatitis B, hepatitis C, and they're like, say they're bleeding and there are a lot of fluids, the healthcare workers do that. Some of them wear a mask that has a built-in visor. Others of them have safety glasses. Now you see a lot of them with the full face shield, and that's to protect on all sides from the virus, any fluids being able to get into your eyes and cause an exposure. So yes, but these are safety glasses or goggles, not regular reading glasses or your regular glasses, because the sides are open. So, in the settings where they're asking you to wear goggles, they're talking about safety glasses. I got a pair, I bought them over at Lowe's, so if I go into a setting and it covers all the way to the side of my eyes, I find those more comfortable than the full face shields myself.
Looks like we have time for one more question. Is it safe for two people wearing surgical masks to talk for 45 minutes in a 6-foot by 4-foot room?
Yes, if they're not infected. If one of them's infected, and they don't have their mask completely sealed and they're completely on, we have to be honest, there are still particles that could come out around these seals. That's why the N95s are so much better, because, if you get the right fit, you have to make sure if you're a small, medium, or large, to have the right one that seals your face, then it really can't get into that setting. But, if you're 45 minutes together and you're not infected and you've got your masks on, that's safer than being with somebody that doesn't have a mask on, is not wearing it properly, and they are infected in the first 5 days where they're most infectious, and you're in the line of it. Yeah.
Okay, thank you. So I see that there were some other questions that we couldn't get to today. I just want to remind everyone that we are going to be hosting an office hours, which is essentially a Q&A session with Maureen. Maureen, thank you so much for your time, and thank you to all of the participants, and have a great day.